The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, advancements in the treatment of gum disease. With us, we have an expert on the topic, Dr. Digiallorenzo. Dr. D, welcome to the program.
Thank you, Randy.
So your patients call you Dr. D. Dr. D. Is that right?
Yep.
Now, before we get into today's topic, tell me about your practice. You're a periodontist.
I'm a periodontist. I was trained in my specialty at the University of Pennsylvania, multidisciplinary training. We trained in prosthetics, orthodontics, so we're multifaceted in how we diagnose and treat. And my practice is very unique. I practice 30 miles west of Philadelphia. I've been in practice 15 years. And my practice has potentially been designed to treat the whole patient.
Okay. Now, you do some unusual things at your practice. It's like a dental spa.
Yep.
Elaborate on that.
Dentistry was very fear-based, and dentistry was a health issue, not only a tooth issue. And so we developed an approach to treat the whole person. We have a nutritionist, we have reflexologists on staff who provide you with an opportunity to truly imbibe in the healing arts as well as receive treatment at your office.
So they like going to your office?
Yeah, they really do.
People don't like going to the dentist, right?
No, they don't.
Do they tell you that still?
They absolutely.
Do you hear that?
Yeah, we have high fear patients that come in and utilizing, single visit protocol with sedation, and our massage therapists doing reflexology and Reiki and all of the things that we do. We tend to bring people to a state of comfort.
Okay. Now with gum disease, let's talk more about, you say that it's also misdiagnosed quite a bit, or underdiagnosed, or patients just flat out don't want to hear about it from their general dentist. They're in for a cleaning or whatever. Expand on that.
Yeah, I mean, gum disease, to get to a moderate to advanced state, it takes a long time. And really, one of the primary reasons that it progresses so far is that it's lack of diagnosis. Okay, lack of home care. Risk factors, diabetes, smoking. So there are a number of reasons why people are afflicted with the chronic disease.
But don't you know when you have it, though?
A lot of times people, no, they don't know. Many people aren't in touch with their health. They're unhealthy, their lifestyle's unhealthy, and so they don't know. And if they're not told by a dentist, they may not know. But even if they are told, it doesn't hurt. See, that's the key, Randy. It just doesn't hurt. So when something doesn't hurt, why address it?
Interesting. Okay, good. But so bleeding gums is definitely a sign,
right?
But is it, with flossing, shouldn't you have a little bit of bleeding or no?
Yeah,
you're saying
you're gonna bleed when you floss, but when you're brushing, when you have spontaneous bleeding, that's an abnormal event.
So receding gums is another one of the symptoms.
Yes, Randy. The receding gums are a symptom of gum disease.
Why though? I mean, what's going on?
Yeah, we're losing bone. The infection is causing the loss of the attachment, the gum, the bone, and so you're going to see the necks of your teeth, and that under many circumstances isn't a normal situation.
So bad breath as well could be another.
Yeah, bad breath, a result of the bacterial infection under the gum line, eventually will cause bad breath. And that really affects people. I mean, people just, you can't imagine what they go through between having bad breath, loose teeth. They don't want to kiss. They don't want to be intimate. There's a whole variety of things going on with their self-esteem. Certainly, when they get to the point where it's moderate to advanced, they may very well not want to smile and become very, very depressed.
Do their teeth become loose?
Yeah, their teeth become loose. Difficulty eating, chewing.
So hot and cold sensitivity.
Sure. Randy, when the gum recedes, I mean, obviously the bone is melted away, the tissue's melted away, and you've exposed the neck of the tooth.
Does this usually happen in the back of the mouth first?
No, it'll happen in the front as well. But you're going to have hot and cold sensitivity because you're losing the supporting structures around the teeth. This infection, so I get this right, it's like, what is it, bacteria? I mean, what do you guys call it? What is it? Yeah, gum disease is bacteria.
So the bacteria underneath the gum line.
Yep.
Starts eating away at the bone?
Eating away at the bone, melting the gum. Yep.
Is that right?
So it provides an opportunity once the pockets form and the gum recedes. We have a bad neighborhood, essentially.
Okay. All right. Now, one of the things you talked about on the phone, you said, Randy, I want to do this show, I want to do this interview, because by the time they get to me, oftentimes their teeth have to go.
That's right.
You say you want to get these people early on.
Yeah.
And that's a challenge, right?
That is a challenge. And again, because it doesn't hurt, the fear factor in dentistry, it's so easy to treat disease early. But when it comes time to let it go 5, 10, 15, 20 years, now people are coming in, and oftentimes we can't save their teeth, Randy. We have to take their teeth out and place dental implants and provide them with perhaps teeth in a day, things of that nature. But if people come in and they're proactive, we have an opportunity to treat them, remove the infection.
Do gum disease patients know who they are? I mean, do they know? I mean, their general dentist said you have these pockets or whatever.
That's right. Most of them do if they're visiting their dentist regularly. But then there's a whole 50% of the population that does not visit the dentist. So we have 50% of the population that just doesn't go to the dentist.
Is it the fear? Do you do sedation, by the way?
Yes.
In your practice?
Yeah, we do sedation. But it's primarily fear-related. Primarily fear-related.
So you're the specialist. Does somebody need a referral to go see you?
No.
Can they call you directly?
Absolutely. Yeah. We have patients calling us directly every day.
What is the, if you had to say, okay, top 2 misconceptions about gum disease are what? With the patient population.
I think the number 1 misconception is it's only about my teeth. Because remember, any infection is very dangerous to your overall health. And that's why we've been for so long integrating nutrition and overall health modification of risk factors into our therapeutic protocol. Because people really, at this point, we understand that periodontal infection and heart disease are closely related. Okay? So,
Why? I mean,
they're
most
both
people
chronic
this
inflammatory diseases. Yeah.
But how? I mean, how is it affecting the heart, though?
That's right.
Help me understand that.
Yeah, if you have an infection in your mouth, every time you brush, you're creating bacteria, which enters the bloodstream, and it's creating inflammation elsewhere. There's no doubt in my mind, Randy, that your oral health is a window into your overall health.
Well, you're a dentist, though. Of course you're going to think that, though.
Right.
Right?
I'm a dentist, but, and I believe this for years, and that's why we've been so vehement about really people making lifestyle changes. So when we
So the fear is, so why aren't they doing anything about it? It's just the fear of the dentist, the pain?
The fear and the pain. But if they understand that by treating their gum infection, once it's diagnosed, they're improving their overall health.
So this laser zaps this chronic infection?
Zaps the chronic infection away.
You kill it.
You kill it, remove the bacteria.
Can you take loose teeth and make them solid again?
It can oftentimes take loose teeth and make them solid, along with other therapies. We may have to work with the bite, adjusting the occlusion or the bite, the way the teeth fit together.
Okay.
So, we really want to look at the whole condition and see how to best affect it. But the laser is a fantastic way to remove the infection in a simple, one-visit, painless protocol.
Do other periodontists ask you, the ones that are doing the scraping and the cutting, the old style, do they ask you, hey, what do you think about the laser?
Yeah, absolutely. They ask me, what do you think about the laser?
What do you say to them?
I tell them they should go get trained and start integrating it into their practice. It is an important component for our patients and as practitioners.
You said there's a cosmetic component to this.
Randy, people don't want to smile. They've been told they have gum disease, they put it off. But, they have bad breath. They know they have this chronic disease. They don't want to smile. They don't want to be intimate. Let's face it, today people are living longer and longer.
Yeah.
So, we're a very social society. 60's like the new 50, and people want to be able to enjoy their lives. But, people come in every day, and I really, really have to listen to them to understand.
And what do they say? What do they say? I mean, how does this interfere? You say it holds them back.
It really does hold them back, because not only do they realize that they have a major health issue, a risk factor for cardiovascular conditions and a variety of other things, but they tend not to want to smile, tend not to want to be intimate, so they cover their smile up. They'll come in speaking to me. For so many years, they've been putting their hands over their mouth because of their breath or because of the way their teeth look as a result of the infection. Because if you're losing gum and bone, it's an extremely ugly, deforming disease. So once it goes on for 15 or 20 years, I mean, if you look in the mouth as someone that has this process going on.
So it's a very slow-growing
It's a slow, debilitating infection, but it's ugly because the teeth get longer, they become anesthetic.
So your message is, somebody's watching this, they have these symptoms, okay, bleeding gums, bad breath, receding gum. If you catch it early, you're saying, How many visits? I mean, could they go in, I mean, ideally one day, once they've been diagnosed, zap it out with his laser?
Right.
Is that too simple?
No.
The way I'm saying it?
Absolutely
that's really
not.
how it works?
That's how it works. So we'll do our diagnostic visit, and then we'll see them for their treatment in one visit. The important part is after that to manage their risk factors and come in for continued maintenance. So that's the key.
And we were sitting in the green room, and you said, I spot it all the time. I see it in people's mouths all the time. And I got insecure. I didn't want to smile big around you. I mean, do you really see it all the time?
Yeah, I do see it. And, you know, you can really tell when people have an infection in their mouth. You can smell it. You can see their teeth have moved. You can see the length of their teeth. So it's simple for people to really self-diagnose. All they have to do is look in their mouth and pay attention.
So bright pink gums.
Bright pink gums.
That's gum disease.
Yeah, absolutely. Bright pink gums.
I see young people with that.
Oh, so the disease.
So you're saying that's an infection that you could zap out and it's taken care of.
That's it. And
Really?
you mentioned young people. You know, we see people from 18 to 70 to 80 to 90 for treatment. And, you know, one of the greatest things about utilizing this single visit laser technique is that we can treat people that are taking blood thinners. We don't have to stop them because the laser light will coagulate the blood. So we don't have any problems. We don't have to cut the gums. So it's perfect for our elderly population.
So no more cutting, no more stitching.
No more cutting, no more stitching. Simply complete in one
Could
visit.
another periodontist that watches this show send me an email and say, Randy, it's just not true. That laser is not as good as scraping it off the gum. I mean, could other dentists argue that you have to scrape it off? You can't do it with a laser.
We still have to remove the tooth-associated bacteria and the tissue-associated. So we still are utilizing, after we lase, we do the first pass of the laser.
Okay.
And we'll show it on the animation. But then we also do clean the tooth of any surface secretions just to smooth it. And then we come through with the second pass of the laser, Randy, to seal up the site. So certainly, I don't think there's a better way to remove infection. And I think retrospectively, as I said, we have 450 practitioners nationwide right now utilizing this technology. In another 10 years, it'll be the standard of care. It's FDA approved, and it is.
But the challenge is getting people for early treatment.
Early treatment's the key. Early treatment's the key, as with any disease
So the fear is pain.
The fear is pain.
Most of the time.
Absolutely pain.
So what
and
about the
possibly
people-
financial.
You said that there are people out there that they've had one side of their mouth with the stitches and those kind of things.
Right. When I first took this laser and utilized it for the first time, I had some patients that we had done traditional periodontal surgery on, and I did the other half with the laser. And
Because you couldn't get them back because it was so painful the first time?
Exactly.
Okay.
But we got them back, and we did the other half of their mouth with the laser.
And what'd they say?
They couldn't believe that I didn't have this earlier, and that if they knew that it was going to be that easy, that they would have just had it all done at one time and would have never thought twice about it.
Okay.
So it's really provided the opportunity for people to leave feeling positive. Of course, coupled with our whole office approach, they're able to leave.
I mean, they're getting
really,
massages during the treatment.
yeah, reflexology, and
Really?
we tend to integrate that in because we really believe that we can stimulate the endocrine system or the body. Because remember, when we remove this infection, there are huge changes in your body. You're removing a major infection, as I said.
And that's not an overstatement at all, by the way, when you say that?
No, not at all. I mean, if this infection weren't hiding under the gums and we took it out, a mouthful of periodontal infection, and put it on both hands, it would cover both hands. People would literally run to the doctor